My name is Audra Taylor. I'm the Vice President of Blood and Tissue Operations at South Texas Blood and Tissue in San Antonio, Texas. Pre-hospital transfusions are so important as it provides an opportunity to provide life-saving interventions before they get to the hospital and hopefully improve their outcome. AABB has been instrumental in the advancement of pre-hospital transfusions. They do a phenomenal job of listening to their membership and ensuring that we add standards and guidance where we need to ensure that we have quality blood products available to our patients in need. So from the beginning, they have worked with membership, and collaborated with other groups to add standards into our BBTS standards. They've been very instrumental in pulling together the committee who worked tirelessly to pull together the first edition of the pre-hospital and out-of-hospital transfusion standards. It is instrumental for EMS agencies to adopt AABB standards, as it's just another stepping stone to ensure that we have the safe and effective administration of blood products. We entrust our EMS partners with life-saving measures every day for whether it could be for us, a family member, someone we know. And so this is equipping them with another tool in the toolbox to respond effectively and providing them with the parameters to make sure it is stored correctly, it is checked correctly, and it is administered safely prior to arrival at a hospital. If EMS agencies are implementing new transfusion protocols, they have a lot to keep in mind. We know that they are experts in logistics. We know that they are experts in quality patient care. This is just another form of treatment that they just need to familiarize with. They are well trained, so it would be the addition of the required training to make sure it is stored correctly, make sure it's labeled correctly, make sure we have the right product for the right patient at the right time, make sure that it is being administered correctly, and we're monitoring those patients for any type of reactions. Also, the handoff to the next level of care is very important, and making sure that the communication from our EMS partners to our hospital partners occurs so that when the patient does make it to the next level of care, we can ensure that they are getting the most effective treatment. I've been attending AAB meetings since 2004 when I was a SBB student. There are a few years when I was unable to attend, but consistently I've been able to take part in this very important meeting every year. A few highlights from this year's meeting, of course, our pre-hospital session where we were able to talk about the new standards, the accreditation process, bring in perspectives from blood centers, our hospital partners, and 4 EMS agencies. Very informative and dynamic session. Also, the Thor AABB collaboration, which generally focuses on pre-hospital setting, but also bringing in updates on platelets, cold store platelets, and a few very important studies. Ask the FDA session, also usually well attended, and providing our members with the opportunity to ask some very important questions. So those are just a few highlights from the meeting this year. Events like this are important because it's an opportunity for collaboration. We all do our best to try to collaborate through email, through Zoom calls, but the opportunity to engage with some of our collaborators face to face. And for a lot, this is the only meeting where that happens. I mean, we have our international partners coming in, we have our industry partners here. And so the ability to meet, greet, collaborate, figure out, talk about the future, this meeting is the perfect opportunity for all that to happen.